Many of you have heard of Dr. Panella before. He operates PriceMDs.com here with us again in Oklahoma City. Began and co-founded in May of 2013, and he currently serves as the head of business development. One of the things that's exciting about what they're doing, Dr. Panella and others, is their embracement of software and technology, and how that can make a huge difference in expanding care to patients that so greatly need it. So would you join me right now in welcoming our next speaker?
I'll speak up here. That's fine. Good afternoon. Well, I'll start with a story. Sort of the past of PriceMDs, or how PriceMD started, was we realized you could find more about a hotel room than you could find about a surgeon. You can go online right now. Everybody's probably staying for 24, 48 hours at a hotel, and you can read reviews. You can see pictures from bathrooms to the fixtures to the bed. But then if I want to have surgery on my knee, I don't know what the doctor looks like. I don't know what their staff looks like. I know no information about their care philosophy, their education, how many procedures or service they do, and more importantly, I don't know anything about the price. And we at PriceMDs decided that needs to change. And that's when PriceMDs began about 2 years ago. I'm here with my team, Dr. Mark Grossman, who's a retired surgeon and hospital owner. I'm here with my CTO, Nick Ionati, and Al Scalzo, the CEO of the company. They'll be here. They'll answer any questions after the show. If you have any questions, or we have a booth over there, we'd be happy to tell you more about our product. Go from there. All right, here we go. Okay, so PriceMDs. PriceMDs is a patent-pending search engine that matches patients to doctors. We coined the phrase, we're the hotels.com for healthcare, because that's what we're trying to model. We're always free to the patient, very similar to how hotels.com works, Orbitz works, cars.com. They come on, they search, they find you. We're here to represent you for the patient. For you, we're a risk-free advertising solution. You pay us nothing unless we give you a patient. So it's completely free for you unless we get you a patient. No annual fee, no monthly fees, no sign-up fees. We have a contract, but it's cancel at any time. That's it. And like I said before, the experience for the patient, it allows you to go online, read about the doctor, read about their care philosophy, their solution, their procedure, services, pricing, education, everything about the doctor. That's the experience we're giving the patient. What I'm going to cover today is a general overview, which I sort of did, how we drive patients to you, and pay for performance. What PriceMDs is. For the patient, we're where America shops for healthcare. Very simple. We want patients to come to our site, shop for doctors, find doctors, read about them, have a good experience, read multiple reviews, and select a doctor. For the doctor, we're a no-risk advertising solution. Rather than you pay for a billboard ad that might cost you $3,000 a month and you don't know who's going to come, you only pay us when we get you a patient. That's the solution we are. For the healthcare insurer, we're a high-tech solution for self-insurance businesses, allowing them to reduce costs for both employees and companies by providing additional access, choice, and low-cost alternatives. Driving patients. We're all here because of price transparency. It's just crazy that one of the most expensive costs for any American is healthcare, but you can't find price anywhere. It's unheard of. You can find it for a car, a hotel room, everything else, but you can't find it for your doctor. You can't find it for your bum knee or anything else. PriceMDs is running commercials right now in Tampa Bay. We're running 30 ads a day on every channel from CNB to CNBC. We're going national with this ad campaign, and it's launching our philosophy, which is we're trying to drive traffic. When Al and I met Charlie a year ago, we couldn't believe what like minds we were and what we were doing. It was the perfect match. The FMMA and PriceMDs is doing the exact same thing. We're just doing it more as an advertising push. He's organizing the physicians. We're organizing the patients. That's what we're doing. For medical tourism goes both ways. We're doing ads we're going to begin doing ads in Edmonton, Toronto, Vancouver, Windsor, and drive Canadian patients that are higher cost procedures to Americans. We're also doing it in Latin America, driving mainly through Florida and the southern states. Our enterprise solution, go into some detail on that. We have a white label product or an enterprise solution that we integrate with third-party administrators, and we add choice to their plans of physicians that are lower cost than the alternatives that they have. So we are an add-on. We are a free add-on to their product that uses an API. We take their choice and we add you to the plan if you are a better cost alternative. We also have tools that we've developed that we've patented or patent pending that allows the patients to know their out-of-pocket expense, their in-network, their out-of-network, and we will bring you in. So if we partner, and I don't want to give names of companies we have relationships with yet, but if their 50,000 employees want to shop for a doctor, they can find you if you're part of PriceMDs, which is free to sign up if you're a lower cost alternative. We've partnered with a major third-party provider of travel that will allow them to travel. And let me just give you a quick story about that. You're living in Orange County, California, one of the most expensive places for healthcare. You need hip surgery. Let's just say it costs $50,000 in Orange County through your plan. Dr. Keith Smith's location offers it for $25,000. One-stop shop. You can come to our site, get it approved by your insurer through our enterprise solution, book travel, all-inclusive, get it approved, not pay the deductible. The deductible is waived if it covers a certain amount of cost. Have the surgery done. You save the plan, $10,000 to $12,000. You have surgery and you didn't pay any deductible. That's our solution. This is how this affects you. We're a no-cost solution until we get you a patient. So there's no, is this on? Hello? It's cancel anytime. We have to have a contract legally, but you can cancel anytime or you can suspend your profile. You control your own page on our site. You control pricing, procedures, services, everything. You fill it out or we'll fill it out for you if you give us your website and we'll upload it with our technicians. There's no setup fees, no monthly fees, no annual fees. You build a profile page with all the information on our site. Patients then come and shop for you. If a patient selects you, schedules an appointment, comes in and does a procedure, within 30 to 60 days, then we bill you after. It's in a trust basis based on you telling us that the patient came in. We have a follow-up system with the patients, but if you say the patient never came in, we don't charge you. It's just like canceling something on your American Express card. You click, patient never came in, you're never billed. Our fees range from $25 to $100. For most surgeries, it's about $100 that you will pay us a fee after the patient comes in and does a procedure or service. It's that simple. Dr. Grossman, who is the founder of this, is a recovering surgeon. And he always says, how would I like to have this done? We built this around you guys. You are our main concern, our main product. Same with reviews. There's a lot of review systems. I don't want to say any names of companies that you get a patient that might not have ever come into you. It might just because your dog is pooping on their lawn and they don't like you and they fill out some bad review. We built it around you guys. You are our customers. You're who we take care of, not the patients. We want to make sure you guys are happy. So our billing system, everything we do is based on the doctor. Just to review, so we covered who PriceMDs is. We're where America shops for healthcare for the patient, for the doctor. We're a high-tech advertising solution that's no risk to you guys. And we're pay for performance. That slide tells a lot, right? Yeah, sorry. This is our commercial, if everyone would like to see it. It's 60 seconds. Ready?
Need to find the right healthcare? Worried about how much it's going to cost? Now find the best quality healthcare at prices you can afford with PriceMDs.com. PriceMDs.com gives you free, unlimited access to its nationwide network of top-grade doctors, surgeons, dentists, medical facilities, and healthcare services.
PriceMDs.com is so easy, and best of all, It's free.
It's the best, easiest way to find healthcare, and it's free.
It's free, and it's easy too. Go to PriceMDs.com, choose your location and the service or doctor you need, compare prices, ratings, reviews, special services, even photos of the doctor and their offices. It's that simple. Shop over 1 million doctors. All the information is delivered free right to your smartphone, tablet, or computer.
This really is the worry-free way to shop for healthcare.
Go to PriceMDs.com now. Find the best doctor and the best healthcare at prices you can afford. PriceMDs.com, where America shops for healthcare.
To reiterate on costs, because it's our product, no contracts, no setup fees, no monthly fees. I'm a sales guy, you guys can tell. Here we go. We never charge you a penny unless we get you a patient. That's just it. I guess the call to action to everyone, to sign up, it's very simple. If you go to PriceMDs.com, you can claim yourself if you're in the system. If not, you can create your own profile. You can ask any one of us. We'll build your profile for you if you like. We'll take your existing website. We'll add everything to you. We'll assign a technician to you to answer all your questions and manage your account for you if need be. It's very simple, and please just come up to one of us during the show. If you have any questions, I can answer some questions right now. Just some legal issues. We're vetted by Hooper, Lundy & Bookman, the largest healthcare company in the country. We follow all the rules on Sunshine Act referral, everything. That's all been covered. If anybody has any questions, Dr. Mark Roseman could probably talk or speak to much more detail on how our product works and how it's 100% legal. And here's our contact information. You can reach out to us. We're a Tampa-based company. We're a SaaS model. Or Nick Ionati can talk to you about the technology of how we host, how we work with our enterprise solution for our solution for third-party providers. And in one-on-one, we could talk more detail on the large companies we're working with that are using us for their third-party administrator needs, or adding professionals like yourself to networks that you're not in. And that's it. So I guess I would open to any questions, or thank you very much. There's a question right there.
Is the fee we pay to you every time the patient comes in to see us, or is it a one-time fee?
Great question. It's a one-time fee. Once the patient becomes your patient, they're your patient. We're not a booking site where they continue to residually use us. We like to believe they'll use us for, if you're a surgeon, use us for surgery, come back for LASIK or other products, because we cover all medical procedures and services. But it's a one-time fee. Once they're your patient, that's it. Great question.
This comes under unrequested advice. So I'm a traditional internist, and I'm fine. Right now, I don't need you. But there's 5 kinds of patients, and I think you need to tailor your advertising campaign to the other kind, the guys who are actually shopping for care. So the patient with a sore throat and a runny nose, or the proverbial chest cold, is not your client.
Agreed.
I don't think so, at least.
No, you're right.
The patient whom I just saw at home, in her home this morning, who's dying, is obviously not your patient. It's end-of-life care, urgent care. In the middle is obviously who you guys are talking about, which is patients who have elective surgery, elective procedures. And I don't think your ads have that hook to the customer who doesn't know any better. I mean, you could probably focus your campaign to, are you contemplating surgery? Are you contemplating a diagnostic procedure? Then come to us. Obviously, the hospitalized patient is not your customer, and certainly not the one lying in the emergency room. The other large group of patients that I take care of are obviously the chronic disease management patients. And it would be interesting to see, after you guys grow and become what you want to be in elective stuff, how you can steer patients to chronic disease management specialists like me. But right now, I think you and Keith and everybody else in this room is really appealing to those folks who don't want to be taken to the cleaners by the aforementioned trolls by having expensive elective surgery. So that's...
Completely agreed. We're not the be-all, end-all of everything. We don't hit every single segment. We're probably not best for Medicare, Medicaid in a lot of situations, not to say we don't help. What we are is we are the elective type situation where you rush into the emergency room in an ambulance, you're not on your phone looking at price MDs. It's just not what we are. But what we're doing for larger companies and corporations, giving choice and bringing doctors like yourself into the system or into networks and giving pricing. And what we're doing is we're empowering the patient. We're educating them on what the cost is, what doctor they're going to see before they come into the meeting. But great points. I do agree with you. We might grow to that point where we might never hit those points because it's a difficult situation to hit. And that's a difficult situation for everyone here is people are going to have issues with higher prices because they are getting rushed to an emergency room and they have no choice. So good point. Thank you, everyone. I hope you have an enjoyable conference.
Yeah, just a comment. Both of the previous physicians and myself, we're all three primary care doctors. So there are primary care doctors in the room and who are members of the FMMA.
Right.
But one of the things I say all the time is that my name is no longer on a list on an insurance plan. So I have to go out and find patients. So I love this idea. I'm certainly going to talk to you later. I believe that patients are definitely going to start looking for their own primary care doctors, and they may not like the list that they have that the insurance is providing, especially as more and more of us get out of taking insurance and being employed.
I'm the notorious Dr. Grossman. I founded Price MD. It's a big tent. All are welcome. If someone's practice doesn't fit into this tent, that's great. If someone does, fantastic. We want to make it easy for you and easy for the patient. We want the patients to be able to find the doctors. That's all it's all about. And the way they're going to find them is because they know what the price is to begin with. But there are other little things involved here that are more subtle that the doctors in the room will appreciate. We are rebuilding the doctor-patient relationship. When I retired from surgery, one of the reasons I retired was because I was tired of nobody thanking me anymore when I operated on them. Because they found me through a book, and I was a utility, and I'm just plug and play and do this surgery, which we did, and that's it. No one thanked me. When I was before HMOs, everybody thanked me. They thanked me effusively. And that was a big part of my reward. That was why I came to work every day. I didn't go to work every day because I knew, I made X number of dollars today. I came to work to take care of my patients. That was the idea. So what I'm saying is that I wanted to rebuild that doctor-patient relationship. This will allow the people who are going to come to the site, look at your profile, look at you, look at where you're located, make a determination that the service you're providing is worth the charge you're costing to them. And then they come in, they're there because they want to be. They're not there because they're told to be. And I think that's a great extra outcome for our site. The other thing is what we're also doing for the patients is we're giving them things that when you're the doctor, you may not appreciate how hard it is to get, which is access and choice. If you're in a plan, you have where I am in Orange County in a PPO, there is one dermatologist for all of Orange County, one. The access is ridiculous. Okay, and that's on a silver type plan. So, but when I go in and when I say to a doctor, I'm going to show up, and they say, okay, this is what it is, and I show up, everything's fine. I can get in right away. I have no problems. And what we want to do is democratize that so that everybody knows what I know as a healthcare professional of how to work through the system. If you talk to the doctors, you can usually get what you want. But most of the time, you don't get to do that because the last thing a patient wants to do is to talk to a doctor about price. When I'm operating on somebody, the last thing they're thinking about is, should I ask this guy, can I discount my fee? No, his fee. No one ever asked me that. No one ever asked me about what I charge or anything else. But they're all thinking it. And this way, we're giving them a way around a rigid system that nobody likes. Thank you.